Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the award-winning Hospital Finance Podcast. Every hospital has different databases and software systems holding different subsets of data, making it difficult to get a complete picture of a patient. Bringing data together to improve the quality of patient care and to reduce costs is critical moving forward. To look at ways hospitals and healthcare providers are bringing together siloed data, I'm joined by Clark Richey, Chief Technology Officer at FactGem. Clark has over 20 years of experience designing and developing software and has taught in the master's program at Loyola University and undergraduate program at UMBC. Clark, welcome to the show.
Thanks for having me. It's great to be on today.
So Clark, I'm sure that most hospitals have a pretty good sense that not all of their data works together seamlessly. How did we get here?
Yeah, I think there's a lot of factors that brought us here. Obviously, one of them is the incredible importance of patient confidentiality and personally identifiable information, or PII and HIPAA data, right? The Healthcare Information Privacy Act data that hospitals, by rights, are so concerned about. So that leads to a lot of concern about how data gets commingled with other things, and that's certainly part of the issue. And I think another part of the issue is just in that our modern healthcare system, a lot of our hospital systems in particular have now grown up and matured through a lot of merger and acquisition processes. So big healthcare groups and conglomerates have come together and consolidated. And so what used to be maybe a handful of IT systems when you were a sort of a standalone single hospital now have become many, many, many duplicate systems. Because of the infrastructure you inherited as the institution grew up. And that presents a lot of challenges.
Yeah, it certainly does. Why don't you expand on some of those challenges for us? Tell us the types of problems that you see that exist because of these data silos.
Yeah, so they exist for the hospitals really across the spectrum, from finances all the way through to patient care. So I was doing some work with a very large Midwestern hospital system, talking with their CFO, who was fairly new to the post. And she was actually really mortified at one point because the CEO had asked her to gather some data to determine how much business with a particular supplier that they do. Seems like a fairly easy question to answer, right? You go into your systems and you're purchasing and you say, hey, how much do I buy from Acme supplier? Well, it took 9 weeks to gather the information because, again, like most hospitals these days, many, many mergers and acquisitions. So there was like 40 to 50 different systems between satellite clinics and secondary hospital sites and hospital sites that have been acquired and merged. 40 to 50 systems that had to be queried and the data reconciled. It was a mortifying experience, but it's not uncommon. It's not uncommon. The systems tend to stay in place. And then sort of on the healthcare side, I think as patients, we see this all the time. There's delays and difficulties in continuity of care and getting information often from one provider within the same hospital system to another, whether that's test results or it's just provider notes. It can be challenging as you move through some of these larger hospital systems to make sure all of that information is really flowing correctly so that people are experiencing the best quality care.
Yeah, I think we've all experienced those hiccups in data, particularly here in the United States compared to some other countries. Clark, what are the types of improvements that you think hospitals should be driving for when it comes to consolidating their data and getting more from it?
Yeah, so hospitals are going to have to continue, of course, to be cognizant of the HIPAA issues. But the good news is there's a lot of technology now that can help. So hospitals, of course, spend a lot of their money, rightfully so, on the patient care side, right? So technology and personnel and equipment that is really interacting, with the patients to improve healthcare. but some of that needs to be looked at in terms of our information systems. There are new ways of storing data, of connecting data that allow you to much more easily take these disparate silos, connect them together very quickly. And there are some really good technologies out there as well for automating and ensuring the privacy of information, such as HIPAA policies, so that you can bring those together and do it really safely without endangering the release of any information that should not be released.
Right. And when you dive into it, we think about data sitting in numerous places across different functions, different teams. Where do you start? Where should a hospital look if they want to bring their data together and make it more useful, really in the short term as well as over the long term?
Yeah, I really am a big believer in starting small and finding an immediate return on your investment. So I think this is particularly important with organizations that have sensitive information like hospitals. You want to start in the least sensitive place possible. As you try to bring about these initiatives in a healthcare organization, you're typically going to hit some immediate firewalls and roadblocks internally because of this concern about privacy. So I recommend people look at areas where there's very little to no HIPAA information, and yet there can still be ROI gained. So that could be by anonymizing some of the data or just removing some of that PII. So that can be areas I've seen this work really well. Looking at Medicare, Medicaid fraud, for example, trying to identify cases in the entire system where that kind of fraud is happening by looking at patterns of behavior across the data, and that can absolutely be done with anonymized information that could later be backtracked to specific patients or providers. Certainly, as well, and it's a big topic, of course, right now is the opioid crisis. Can we start to bring together data just to look at what providers are prescribing these types of medications, how often, to what kind of patients? Again, anonymizing the patient data, so you're keeping all the HIPAA regulations intact, but it's a fairly small subset of data, and you can achieve a really important benefit there. And it's something that's really easy for everyone to kind of rally behind at this point because it is such an important national crisis.
Yeah, good places to start, Clark. When we think about integrating this data and then deriving insight from it, of course, which is what you really want to do, combining that information is going to consume resources, right? Whether they be human or financial. What kind of ROI can a hospital reasonably hope to achieve by taking this type of a project on?
Yeah, I think you've got to be really careful that you don't take on what's sort of in the IT industry we'd refer to as a death march project, right? A really long engineering and time and money intensive project that just goes on and on and on. You obviously need to avoid that. So again, I would look for solutions that require little to no actual software engineering in-house, right? So you want to find no-code solutions, and there certainly are out there, that let you bring this data together really, really quickly. I always recommend start with a pilot, right? Start something small. Spend 4 to 6 weeks maximum taking a small subset of data together and saying, hey, does this really work for me? And does this product do what I have been told it does? And can I start to see where this ROI can come from? That gives you a chance to fail really quickly with a very low investment, and then proceed from there. You definitely don't want to have to involve a whole ton of outside consulting and engineering and so forth, because you do need to spend those important time and financial resources elsewhere. So again, I would definitely look for newer data technologies. Graph databases in particular are super helpful at this point, and really try to find a no-code solution so you can get there with as little pain as possible.
Clark, great ideas and insights today. If someone wanted to find out more about you and your company and what you do, where can they go?
They can go and find information about my company and our products at our website. It is FactGem, FactGem.com. And I'm available on LinkedIn as well. Just search for Clark Richey or FactGem.
Clark, thanks so much for joining us today on the Hospital Finance Podcast.
Thanks for having me. It's been a pleasure.
If you have a topic that you'd like us to discuss on the Hospital Finance Podcast, or if you'd like to be a guest, drop us a line at update@bessler.com.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.